Welcome back to HealthWise. With us is Dr. Paul Miller from DCI, and we were talking before the break about the effects of dialyzing. Well, actually, we didn't get into the effects, but we talked about advanced care planning, because it may not be right for that particular person, dialyzation or whatever. You know, is it going to be right? Why would people not want to dialyze, you know, like let's say an elderly person that's 98 years old? What could be some of the downsides, I guess?
You know, as we get older, our blood vessels, they become very, very fragile, friable vessels. Just like a drying rubber band that you leave out in the sun and exposed to the weather conditions, become very, very friable, very, very brittle. Okay, so if you stick a nail through it, that nail won't seal through that rubber band like it should. But in a fresh blood vessel is just opposite of that. A fresh, young, strapping 16-year-old gentleman is going to have a blood vessel that's just like a fresh rubber band. So you stick a needle or you stick a tube through it, it's going to seal around it. Well, our blood vessels get fragile. We see a lot of bruising on older people. So hemodialysis becomes challenging to help these people without hurting them. Okay, the older we get, the less able we are tolerable to changes, removing fluid, shifts in electrolytes. So that dialysis procedure is very taxing on the body, the heart, and that person. Go through hemodialysis in center 3 days a week. You're trying to make up for kidney function that's usually 24 hours a day, every day. It's very difficult to achieve goals. Those people get drained. You see them, right? They'll transport. They're drained. They feel bad. So most older people who've lived their life, who have faith in the Lord, say, why would I want to go through that? I've seen my children or my cousin or my family or a friend who's been tortured on dialysis. So they want to look at what are other options. And there's so much research out right now to say that age is one of the biggest factors in whether or not someone will do well with dialysis, because of the body's inability to tolerate those shifts. Now, there are different forms of dialysis. Peritoneal dialysis that you can do at home through the belly is gentler. You do it every night. It's a gentle procedure that families can do on older people and even younger people. It's for everybody, except people who've had a lot of belly surgeries. And those people do very, very well. It's gentle on the heart, it's safe, it's easier. So there are options. So advanced care planning is not just whether they should be on hospice, no dialysis. It's what are the options and planning ahead. Can an older person, or should they be on peritoneal dialysis with family at home, not having to be at someone else's schedule, having to transport, wait, sit, transport back, and lose your quality of life being in that center, sitting in an uncomfortable chair for 4 hours at a time. Dialysis in an older person, why they would not want dialysis, because maybe they feel it's their time to be with the Lord and they don't want to suffer. Maybe they feel that, you know what, I've seen others suffering, I don't want that to me. Maybe they feel that they've known what their options are, and that they realize that dialysis will not make them better. For whatever other reasons they're sick, will not maintain or improve a quality of life that they're acceptable. And that's why education, counseling, and advanced care planning is so crucial. I mean, advanced care planning, if you think about it, if you're young and able, advanced care planning means, am I a candidate for a transplant, kidney transplant? Well, send me early when I can get there, because the waiting list may be 1 to 5 years, depending on your condition and what you need. Secondly, if I'm getting close to dialysis, what can I do to prolong my health? And what can I do? And what can the doctor do? What are the roles? And then the next step is obviously, if I'm not a candidate, then let's talk with family. Let's get on the same page to decide what are the available options. Because you better believe, if you ask every nephrologist in this world, ask them what they would do. They'd tell you, I don't want that hemodialysis. I want to be at home. Or if I'm doing hemodialysis, I want my family dialyzing me at home, because it's safer, it's better, it's been proven to improve quality of life for the patients. You just have to have your family engaged with it and the patient engaged.
Right. Well, okay, so advanced care directive, when you said that we, you know, as the patient, we can do this, I mean, at your office, for instance, or at DCI, what avenues would we take to start that? Will we go through a social worker there or what?
For advanced care planning?
Sure.
Okay, establish advanced care planning. If a patient comes in at stages of kidney disease, stage 1, stage 2, 3, 4, 5, or on dialysis. So stage 1 being very early kidney disease, which is going to be 1 in 8 people. Stage 2 is going to be more progression to 3, 4, 5, where you're going to be on dialysis. Advanced care planning with us starts in stages 3. If it's going to be prolonged, early 2 stages, looks like it's going to be a long time with chronic kidney disease before you progress. The advanced care planning for more aggressive things start at stage 3, where we talk about whether you need a fistula, transplant evaluation. When you start getting more, 3, 4, 5, then you really have to have conversations about, tell us what you want, bring in the family, let's talk to other patients, see what's right for you. You're right for your family setting, for you, what we can do for you, and what you can do for yourself. Stage 1 and 2 of kidney disease, if it's someone that looks like they're going to fall off quickly, or if it's someone that has other comorbid conditions that preclude need for dialysis or desire, let's say advanced dementia, advanced metastatic cancer that is in an older person, that very short period of life. We're not here to torture people. We're here to help them with realistic expectations, and that's when we talk about more about whether or not hospice determination is appropriate, because it's important to get hospice involved early, because we know it's well proven. If hospice is involved early with patients who are not going to be on dialysis and are patients who have a life expectancy that's going to be not too long and that they're going to be in discomfort, then you need to plan early, decide early who it's going to be, so that there's a seamless transition. You're not coming in the hospital and not having an established relationship with comfort care experts.
Right. Okay, Doc, we're going to take one more break, and then we're going to come back and talk some more about advanced care planning.